Hi, so today I wanted to talk about the importance of advocating for yourself as a patient and how does this relate to lung cancer diagnosis. From my own experience, and also recent studies show, also I think a lot of lung cancer patient survivors could say the same, that recent studies show that about 22.5% of cases, lung cancer cases, have been misdiagnosed. And from my own lived experience, my PCP, my primary care physician, actually, when I told him about my symptoms, he said that I should go home, boil some honey, or no, boil some water, add some honey, and add some lemon to it. And he was completely dismissive of my symptoms, even when I came back and I could barely finish a sentence. He said that I was young and that I was going to be fine. Unfortunately, that story that I have continued on for another 3 months, even with other healthcare teams and other doctors. And the sad part is that I have many friends in the lung cancer world who will say that they experience the same. So this is why it's so important, because when we talk about lung cancer and misdiagnosis, I know that not everybody is going to have lung cancer, but if your doctor is not saying like you should get an x-ray, or if they're not proactive, if they're just kind of dismissing you and saying you're going to be fine without asking for those follow-up tests such as an x-ray or a CT scan, it's important for you to really advocate for yourself. Like your life could depend on it. So this is how a lung cancer misdiagnosis and how self-advocacy as a patient, even though it's hard, I'm telling you, you deserve to be heard in the clinical setting. If you feel like you're getting dismissed, you could write that down on a piece of journal. If you're not like actively confrontational, like a confrontational person, please know that you could seek better health care. Or I know it might be very chaotic. I don't know if you are a caregiver watching this, but lung cancer gets misdiagnosed all of the time. A lot of lung cancer patients get dismissed, or people actually don't feel their symptoms as well until they are stage 4 or at all. So this is why it's important to be proactive with your body, but also know, I hope that having this piece of information that lung cancer can get misdiagnosed. I still have a drawer full in my closet of the medications that were given to me that I don't even need. A doctor had also said that in the urgent care, he looked at my husband, kind of dismissed that I was in the room. He looked at the x-ray, looked me straight in the face and said, "I really don't think this is cancer. I hope it is not